So let's dive into something, well, genuinely surprising today. Did you know that our healthcare systems, the very systems designed to, heal us, are actually quite significant contributors to climate change?
Yeah, it's a bit of a paradox, isn't it? We're talking around 4, maybe 5% of global emissions.
It really is. And what's really caught my eye is a recent study looking into how policymakers themselves are grappling with this. So for this deep dive, our mission is really to unpack their views on getting to net zero healthcare. What are their ambitions? What uncertainties are they facing? And maybe most interestingly, what they don't see as trade-offs.
And it's fascinating to see this isn't just hypothetical talk anymore. We've got over 80 countries signed up to the COP26 Health Programme.
80. Wow.
Yeah, and get this, 45 of those have specifically committed to net zero healthcare by 2050. So there's real momentum building.
That's a pretty strong global signal. What's really driving them, though? What's the core thinking behind it?
Well, fundamentally, it seems deeply tied to healthcare's, social mission. That core ethical principle, do no harm.
Hmm.
Policymakers feel this profound obligation to act. It's about protecting patients, not just now, but from future climate harms, too.
Right, extending that do no harm idea to the planet itself, because that impacts health down the line.
Exactly.
Right.
It just makes sense for the health sector, given its whole purpose.
And this obligation, it covers everything, right? Not just the obvious things like keeping the hospital lights on.
Precisely. It goes way beyond the direct emissions, the scope 1 and 2, energy use, hospital operations, things they can more easily control. They're really starting to acknowledge the huge impact of scope 3 emissions.
The supply chain stuff.
Exactly. Pharmaceuticals, medical devices, all the things flowing into the hospital. In England, for instance, that scope 3 can be like 62% of the total footprint.
62%. That's huge.
It's staggering. So
Yeah.
even though it's less directly controlled, they're accepting, 100% responsibility for it. It's the hidden giant.
Okay, so you have these big international commitments setting the direction. But the study also mentioned something about drive coming from within, like a bottom-up energy.
That's right. Those political commitments, like COP26, they absolutely legitimize the work. They give it official backing. But a lot of the real practical push comes from passionate people within the system, clinicians, managers, administrators.
Right. But then ambition meets reality, I suppose.
That's the crux of it. Decision makers face very real constraints. There's ambiguity about the upfront costs. Although, interestingly, many are starting to frame these not as costs, but as investments that can actually save money long term.
Okay, like energy efficiency upgrades or something.
Exactly. But then you also have the intense pressure of immediate problems, hospital waiting times, staff shortages. It's a constant balancing act.
Which brings us to something I found really striking in the findings. This idea that policymakers generally reject a direct trade-off between cutting emissions and patient care. That sounds, well, almost too convenient. How do they square that circle?
They make a really interesting distinction. It's between sort of theoretical trade-off and practical ones. So take single-use equipment. The idea that you must use it for safety might be what they call a misperceived trade-off. Maybe reusable options, properly sterilized, are just as safe or even safer and more sustainable.
Ah, okay. So challenging assumptions.
Precisely. And they point to lots of initiatives that offer win-wins or co-benefits. Think about telehealth. It cuts down patient travel, reducing emissions, but it also improves access for many people.
Or those anesthetic gases.
Perfect example. Switching to lower carbon anesthetic gases often has zero impact on patient safety or outcomes, but a big impact on emissions. Win-win.
So reframing costs as investments, finding those co-benefits.
Mm-hmm.
But it's important we don't gloss over the differences, right? The study mentioned low and middle income countries, LMICs.
Absolutely vital point. For LMICs, the perspective can be quite different. They're often dealing with the immediate health impacts of climate change right now, so their urgent need is often for basic resources, infrastructure, adaptation. The investment conversation feels different when you're already facing climate-related health crises. Their priorities are understandably focused on immediate resilience.
Right. Context is everything.
And ultimately, the consensus seems to be that hitting net zero isn't just about tweaking things, making small efficiency gains. It requires broad system transformation.
System transformation. What does that look like in practice?
Well, think bigger picture, like rebalancing care away from huge, resource-hungry hospitals towards more community-based prevention and primary care, or even tackling the social determinants of health, things like housing, poverty, air quality, which ultimately reduce the need for healthcare interventions in the first place. That's a huge shift.
That is fundamental change.
Yeah.
And embedding climate thinking into everyday decisions must be tough, like carbon weighting and procurement you mentioned.
Exactly. How do you actually build the carbon footprint into decisions about which drug to buy or which piece of equipment alongside cost and clinical effectiveness? That's a major operational hurdle. It requires changing how budgets are allocated, how value is assessed.
So wrapping this up, there's clearly real ambition among policymakers for net zero healthcare. They see the ethical imperative.
Definitely. The will seems to be there.
But there's also significant uncertainty about the how, the practical pathways, the costs versus investments, and especially how to achieve that deep system transformation. Which leaves us with a thought for you, our listener. If policymakers generally believe there isn't a necessary trade-off between climate action and good patient care, how can we leverage that perspective? How can it help accelerate these huge necessary changes in healthcare systems everywhere?